Mothers have been called upon to present their newborn babies for sickle cell disease screening for early detection and comprehensive management of the disease. Director, University of Abuja Centre of Excellence for Sickle Cell Research and Training, Professor Obiageli Nodum, made the call during a workshop organized for nurses, community health workers and lab scientists on newborn screening for sickle cell disease. Correspondent Lois Abbasambo has the details.
People estimated to be living with the sickle cell disease globally, Nigeria is said to be the epicenter with about 4 to 6 million people living with the disease. The Pan-African Medical Journal estimates that 1 in every 4 Nigerians has a sickle cell trait, and about 100,000 to 150,000 newborns are diagnosed with sickle cell disease annually in the country. With this alarming number of sickle cell diseased newborns in the country, the University of Abuja Centre of Excellence for Sickle Cell Research and Training embarked on a program to screen newborns and, if diagnosed with sickle cell disease, are treated. During a training for nurses, community health workers and lab technicians, Director of the Center, Professor Obiageli Nodu, spoke on the program and its importance in tackling sickle cell in Nigeria.
We have a free genotype test, a screening test for newborn babies in the FCT in 20 primary healthcare centers. We have identified 52 babies with sickle cell disease. But these some of the parents have not come to enroll the babies in the pediatric sickle cell program at the University of Abuja Teaching Hospital. We want to say that if you were told that your baby has sickle cell disease, bring that baby for confirmation. Bring the baby to the clinic on Wednesdays, at the pediatric clinic, so that we can educate you on how to look after the baby, so that we can give you the free drugs that are available.
Stakeholders highlight the importance of newborn screening, as early detection goes a long way in dealing with sickle cell disease.
Early detection is key in the management of sickle cell disease. It's been proven again and again that if you start early intervention, the babies get to grow and live to longer periods, okay? And because the early intervention tends to help prevention of early onset of complications of sickle cell disease, and that tends to give them a greater long lifespan than if they are not detected early.
Since the onset of this program, the major challenges is this misconceptions, this stigmatization, another thing, and another thing is financial constraints, because what most mothers complain of is they don't have the money, they don't believe in what we are doing. That is not possible to identify a newborn as soon as they are giving birth to. But we tell them, because immediately we get to the health center, we let them know that there are new machines, there are new equipment that can identify babies as soon as they are born. And we show them, we make them to see the result.
Sickle cell disease is a group of disorders that cause red blood cells to become misshapen and break down. This happens when the red blood cells contort into a sickle shape and the cells die early, leaving a shortage of healthy red blood cells, and can block blood flow, causing pain, often called sickle cell crisis. However, complications for children with sickle cell disease can be vastly improved through early identification via newborn screening and medical interventions. Lois Abbasambo, ASO Television News.